Hello everyone, I'm Corbin Snardon and welcome to Power to the People, your information station for what you need to be empowered in this community. Today's guest, we have Mr. Terrance Adams, and we're so glad to have him here. He's going to be talking about healthcare and his own ventures into entrepreneurship. So Terrance, we want to welcome you to the show today.
Corbin, thank you for having me. I'm excited to be here today and want to definitely empower some people within the community today to step out and on faith and do what they need to do to start their own businesses or to be in leadership.
Well, awesome. So for those in the community who don't know who you are, just give us a little bit of a background about who Terrance Adams is. Where did he come from?
Yeah, so I am originally from Coshada, Louisiana. It's a small town in northern Louisiana, right outside of Shreveport. Grew up there, probably about 2,000 people in that community. And so I came to Paducah, and a lot of people say, why did you come to Paducah? Well, if they knew where I grew up from humble beginnings there, they would say Paducah's a lot bigger. We didn't have a Walmart, maybe three stoplights. But I was an athlete in school and went on to go to undergrad at LSU down in Baton Rouge, Louisiana. Pledged a fraternity there, Omega Psi Phi Fraternity Incorporated. I ended up finishing with a Bachelor of Science in Health Service Administration. And then I went on to graduate school at the University of Louisiana at Lafayette, where I pursued my MBA with a concentration in healthcare administration. Did some work there with local hospital, which then got me the opportunity to come here to work with Mercy Health here in Paducah back in 2014. And I've been there, I guess, almost 5 years now. March will make 5 years. Started out as an administrative fellow, working with the executive team in a learning and training role to be an executive, and then was able to transition into director of orthopedics in August of 2015, and so I've been in that role for a while now. Going
into your field in the healthcare, you said you are now at Mercy Health, and familiarize us with your position.
Yeah, so as the Director of Orthopedics and Rehabilitation Services, I work with the orthopedic physicians, kind of as a liaison between the orthopedic group that we partner and align with, the Orthopedic Institute of Western Kentucky, as well as the hospital. And so my role is more growth and strategy and operations. And I'm also responsible for the therapy department, outpatient clinics, and our inpatient rehabilitation facility, which is a 28-bed unit on the 8th floor of the hospital, where we provide nursing services and all of the rehabilitation services for someone who needs post-acute care after they've been in the hospital or something. And so we see a lot of stroke patients up there, a lot of hip fractures and things like that, amputees and spinal cord injuries and brain injuries there. And from an orthopedic standpoint, my role there is really doing a lot of the service line strategy, developing programs. We do about 1,000 total joints a year, all your hip and knee procedures as well as total shoulders. And so pretty busy practice, pretty busy program. I have about a $75 million budget that I manage, as well as 75 FTEs. And so nice size position there at Mercy, and I'm very grateful for the opportunity, because Mercy, again, I came in as an administrative fellow, and they saw fit to transition me to a senior leadership role within about 16 months in that training role. And so I was only supposed to be here for 2 years, and here it is almost 5 years, and Western Kentucky has been really good to me.
Well, we're glad to have you. So you mentioned that you came in as an administrative fellow, and then you transitioned to a senior leadership role. So that's a big jump.
Yeah.
So talk to us about that leadership role. How do you feel being in a particular leadership role? Because in Western Kentucky, you know, there's only 2 hospitals here in Paducah, and not a lot of the leadership is African American.
Yeah.
And so, you know, talk to us about being an African American man in a senior leadership position at Mercy.
Yeah, it has its challenges, being an African American male in leadership. And not only am I an African American male, I'm a millennial, I'm young. So when I started out, most of the employees that I have are older than I am, a lot older. Some are like my grandparents' age, almost. And when I say older, they're seasoned. Let me rephrase that. My
seasoned
wife
sounds a lot
That's my
better.
wife coming out of me. They're seasoned employees, and very experienced. And so coming in, you know, you're green and you have to learn from them. You have to listen. But, you know, again, going back towards being a man, being an African-American male, we can sometimes come off as a little boisterous or maybe a little aggressive, you know, when we say things. And I've actually was told once before that when I present an idea, a strategy to a group of other leaders, that sometimes it sounds aggressive. But, you know, if someone else says it, who's just being quite honest, a white counterpart of mine, our colleague, it's well received. And so we're saying the same thing, just in a different tone or different way, and it's just well received coming from someone else. So, you know, I mean, you have to be able to navigate those waters and build those relationships and that rapport. You really work on that a lot to be able to build that influence, because the influence is really key for leadership. And so, you know.
You were mentioning like navigating the waters, you know, having to navigate through that. So have you found in your personal experience difficulty navigating the leadership position? Because like you said, you know, sometimes we get seen as a different way. Being young, millennials, black professionals, you get viewed as a different way, viewed as the aggressor sometimes, or we say things differently, or things are taken out of context sometimes when we say them. So have you had difficulty navigating those waters through leadership, not just in age, but in just sheer administration, relationships, values, co-workers, those kinds of things?
Yeah, you know, the job has its challenges, but you know, I've had those experiences. I've been able to conquer those problems. I think if we put it on the table from a leadership standpoint, I want other leaders to hold me accountable, and I'm going to hold you accountable as well. And so when we have our differences, it's best that we sit down and talk about it like adults, like leaders, you know, and we get past it. And so I think as long as you're willing to do that, you know, you can get past it and continue to build a relationship with those people. But I mean, it's a part of life. It's a part of the leadership journey. Everyone's not gonna like you. All of your employees are not gonna like you. There are gonna be other leaders who are not gonna like you. But you're not really there for people to like you. You're there to get a job done. You're there to lead. And as long as you're able to influence and do what you need to do, and also be able to produce. If you're not producing, you're not producing results. You're always coming up with problems and no results or no solutions, then you're not going to have a lot of influence. And so that influence, again, is key in those relationships.
Yeah, influence is definitely a real critical feature. You know, being at a senior leadership position in Mercy, I'm sure that you're also very active in the community in that role, having to represent the hospital in different ways, or just representing yourself in the community. Because how many people do you see that when you walk into the Paducah community, you see, oh wow, there's a man, he's the senior director of orthopedics, or there's another black professional over there. It's not something that millennials, especially in the city, see too often. So what's your experience in the community as far as a leadership role?
Yeah, so it's not a lot of African-American leaders in the community in these leadership roles in organizations. You know, when I first moved here, it was a lot better than what it was when I first moved here in 2014. I can tell you that. I didn't see a lot of black people at all. But, you know, and definitely coming from Louisiana, where we have, you know, it's the South, it's a higher percentage of African-Americans. Right. It's just not that here. And so moving in, I was challenged to really build relationships with just a wide range of people, older, more seasoned, younger, just people who are just from different backgrounds than I am. And I think that's part of my skill set, though, being able to build those relationships. But coming in, I had to be involved in the community. I had to get out there. I had to build those relationships, not only because it's good from a leader perspective in the hospital, but one of our cardinal principles within the fraternity is uplift. And I believe in uplifting the community. That's a value of mine, a core value, and that's why I'm involved in several different not-for-profit organizations. I sit on the board for Oscar Cross Boys and Girls Club. I've been on a board member there for many years now, for most of the years that I've been here, as well as PATS, the local transit authority, as well as Project Care at Paducah. And so just being involved in the community is near and dear to my heart, and not only just with those organizations, but being involved with the NAACP and other African American organizations around to spread knowledge, resources, or whatever that may be.
Yeah, absolutely. So the community involvement piece is extremely important. I think so many people move here and they're starting off their professional career and they forget that you should be involved in the community. There are things that you should do. Work, your job is good, work is good, but you also need to do some things in the community. So to see a young African American actually out serving on boards, serving in the community is a huge deal because it's not something that you readily see. Everybody has their own thing, true, but to see people doing service is a wonderful thing. And so kind of shifting from that, you not only do service in the community, as we understand it, you're also venturing into entrepreneurship too.
Yeah, man. So my wife and I started Bayou Southern Catering back in June of 2018. We had our first event in August. Which it had its hiccups, but we learned a lot. We've learned a lot over the past 7 months with doing the business, and it's been a journey. We are excited about it. We're looking to expand our services, expand our footprint. We want to be mobile, and so we're looking to do a lot to bring more services to the people of Western Kentucky. But just for those of you who don't know, Bayou Southern Catering is a Southern cuisine, Louisiana cuisine company. We do a lot of Cajun and Creole cooking, and so you may see me with a big black pot stirring up a gumbo or stirring up some jambalaya, and so we really enjoy that. We're looking to do some seafood boils, crawfish boils, and things like that here this spring. Awesome. We're in the season for that, so look for more from us. Awesome.
So when you started Bayou Southern Catering, how did that come about? Nothing comes out of nowhere. So how did that get created? Where did that idea, that concept come from?
Man, a lot of people like Louisiana cuisine. I hear you went to New Orleans not so long ago, and I'm sure you enjoyed the cuisine.
Oh, the cuisine is top notch.
And so I, just looking at opportunities where you may have an opportunity to start a business or provide a service for someone, that from a catering perspective and a food perspective, that's one thing that we're missing here in Western Kentucky. And you can take Louisiana food anywhere. I've been cooking for many years now, and I really learned from my fraternity brothers, to be honest with you. I had a lot of fraternity brothers from Southern Louisiana. As I said earlier, I'm from Northern Louisiana, so most people will call me a Yankee in Louisiana. I'm not really from Louisiana, from Texas or Arkansas, but I learned how to do a lot of the Cajun and Creole cooking when I was in undergrad and grad school, and as I continue to develop my craft while I've been here, just decided to step out on faith and say, you know what? A lot of people are asking me, why won't I cater this, or why won't I do certain things, or and some people want me to start a restaurant. That's not really on the agenda right now, but decided, hey, let's step out on faith. Let's do this thing. Let's figure out what we can do. Let's build some generational wealth. We're not wealthy. We're not, we're still trying to get in the black right now, but as we just started with all the startup costs, but we want to be able to pass something on to the kids, start a family business. That's what has been woven into the American fabric, right? Entrepreneurship, or just owning your own business, being a small business owner. And so, I want multiple streams of income. I can't just rely on my career. I also want to pursue multiple streams of income to build that wealth, because we in the African American community don't see that often.
I agree. You know, generational wealth, being able to have a legacy and pass something on to your children is a fantastic thing. And entrepreneurship, you know, it's people say that word and people say, oh, I want to start a business, I want to do this, but they never get it off the ground.
Yeah.
And you mentioned earlier that you said, you know, you had some hiccups and things that when you first got started. So would you mind sharing some of those hiccups or challenges that you had when you first got started trying to get the business? Did you feel like you were way in over your head? Was it some things that you just missed? Talk to us about that.
Yeah, so there's a lot of planning. You know, I did a lot of research and was doing a lot of planning prior to, and sometimes I get a little impulsive and just say, you know, I'm just going to do it, forget it. But as I listen to different entrepreneurs, you know, a lot of times you fail. You know, you fail maybe 4 times before you actually, you know, strike gold or whatever. But you know, we just, when you start thinking about from a catering standpoint, what can you service? You know, how mobile can you be? You know, what kind of facilities you need? You know, in order to be official. You know, some of those things I didn't research, and so I had to get into the business and then understand. Okay, I need this in order to have this license. I need this license with the city. You know, and this is what it's going to take. This is how much it costs. You know, so some of the startup costs wasn't included in my initial business plan, but you know, we were able to accomplish it. And now when you look at it, you have taxes. So, you know, I would tell anyone or advise anyone, get you a CPA early on, someone who can advise you on how the tax structure is going to be set up to ensure that you're setting your pricing right and all those things, and really truly understanding your costs. So that you can create a profit and have a margin. And so yeah, I mean, you know, those are some challenges. And then as you think about expanding, you know, you want to be able to have the funds to be able to do that. You need the capital, or you need the assets, and are you going to have to go to the bank and get a loan? But also not just looking at loans, looking at lines of credits or whatever you can do to have access to that capital to be able to expand your business. Because right now I'm limited. I don't have employees yet. You know, we're doing this just my wife and I on the side, and so there's opportunities for us to capture business during the week. A lot of catering, you know, at different meetings for businesses, but currently we have to turn those jobs down because we don't have the bandwidth. And so if we want that business to grow, we're going to have to go into that market. Yeah.
It sounds like you did quite a bit of research up front. And of course, naturally, as an entrepreneur, you're going to discover things along the way. I know in my own ventures, you know, you fail 3 or 4 times before you figure out like, oh, okay, this is what I should have done the first time. But I love the fact, and going back to this topic, that you mentioned generational wealth, really wanting to pass on something for your children, to keep something in the family. Why is that such an important focus for you?
Just when we look at the Black community, we don't see that a lot. I mean, I'm not inheriting anything from my family. My dad, you know, he's a truck driver. He has his own business, and he's been doing that for many years. But you know, I've actually talked to him. Let's start a family trucking business. Let's do something on, you know, that we can pass on. Like you said, have that legacy. Because with that, I want my kids to have the opportunity to do whatever they want. They want to go to college, and you know, we can pay for that. We can afford to pay for that. They don't have to get student loans and go into a lot of debt like I did coming out of college with $100,000 of student loans and trying to get all these degrees. You know, and so if we can build the wealth for them, something that they can take and have as their own and pass on to their kids and their kids, I think, you know, that's what changes, you know, the mindset of a family, that changes that heritage, that lineage, and just sets a lot of people up for success.
Yeah.
You know.
I definitely agree. When we look at some of the most successful families that have ever been built in America, if you look at your Rockefellers, your Vanderbilts, your Carnegies, those individuals started off with one person or two people having their own business and then built wealth and passed it on to future generations. And they've been able to maintain that or go seek their own ventures and things. So I definitely think that's important because we don't see it in the Black community enough. We don't pass on very much to our kids, maybe debt, but not much more than that. And so I think that that is a key factor. So what would you say to the young person out there who is wanting to go into entrepreneurship, who's wanting to be a leader in their community? What would you suggest to somebody who's up and coming?
Yeah, you know, I would say just do it. Like, steal that from Nike, man. Just do it. You know, you're going to have some challenges. There are going to be barriers, but don't let that stop you. You know, if you fall, get up, keep going. You know, you can't let those things be limiting factors for you. You know, and what I want my sons to see in me is that, you know, they see a hardworking dad who's a provider, someone who's God-fearing, and that is willing to take a risk. It's going to be risky. Entrepreneurship is risky, but you have to be willing to take that risk. And I would just say, just take it. You know, be a risk taker. Take calculated risk.
Take calculated risk.
Calculated risk. Calculated risk. And just make sure that, again, like you do your research. But again, just if it's God's will, you know, if He's talking to you and He's putting that in your spirit, then just do it.
Awesome, awesome. I think that's great advice. So when we talk about being able to take those calculated risks, when we talk about venturing into entrepreneurship or even in career, you know, you're in the healthcare field, but I doubt that you just wandered into it. Most people are inspired to do something or pushed into something. So where do you draw inspiration from to be able to do things like in healthcare, to be able to be an entrepreneur? Where did that inspiration come from? What is the drive?
Yeah, so my mom is in healthcare, and actually I started out in nursing and was going on the clinical side of healthcare. And once I was in nursing school and got into clinicals, I'm like, I don't think this is for me. I actually wanted to be a nurse anesthetist. But as I was in undergrad, I realized that I had a lot of business skill sets, you know, a lot of those soft skills and just, you know, really wanting to get into the data. I was always really good in math and science and things. And I just decided, you know what, let's look at healthcare administration. This is a booming field. I had a mentor who was in healthcare administration, one of my fraternity brothers, and we talked about it, and I really understood that there was a lot of earning potential. There's a lot of service there, because when we look at definitely Catholic healthcare, not-for-profit leadership, it's servant leadership. You know, we're not just in it for the money or just because it's a job, but there's a major impact that we have, not only on our staff, but all the patients that we see within the facility based on the decisions that we make, the strategies we put in place to reduce racial health disparities, as well as provide more resources and care for people within the community. And so when I saw that I could be a nurse and touch a lot of patients at the bedside as an administrator, I have a wide net that I could cast to help more people. And so business has always been intriguing to me. And as I continue to grow and develop as a leader, I just had an understanding that, you know, again, as we trying to build wealth, you can't do that off of one income. And so entrepreneurship had to be the opportunity. A good friend, he and I started a not-for-profit in our hometown to give back to the local kids, provided a scholarship. When we were younger, we always said, man, this small town doesn't have anything. We're going to come back and start a business. I mean, we were young teenagers, early on, probably 12, 13, saying, you know, we're going to start a business. We're going to bring a business back to Coshada one day. And he and I both have ventured into entrepreneurship, and we're always talking about other business ventures that we can do. And so I'm just, you know, I'm just happy to be a businessman. Happy to be. I'm grateful that God has provided me the skill sets and the experiences that He has, and just has blessed me with these opportunities. And we want to continue. We want to continue to build on what we have and grow and do more.
Well, awesome. Real quick. So you mentioned, the disparities in healthcare, and obviously Mercy does a lot in there, as well as our other hospital here in town. I know that they reach out to the community quite a bit to encourage people to get healthier, but what can the community do as far as reaching out maybe towards in the healthcare industry themselves to check on their own health? What options do they have to try to get healthier? I think that's a big key factor for our community.
Understanding your health factors, your risk factors, taking control of your health, basically. The best way to do that is to do your annual screening. Get connected to a primary care physician. Mercy, we have over 50 primary care providers in the market, one of the largest primary care networks in Western Kentucky. And so you have to start there. Start with your primary care, take control of your health. Get insurance. If you don't have insurance, make sure you're covered so that you can have access to a lot of the preventative care, because the preventative care is covered. Usually at 100%, you may have to pay a copay, small copay amount, and with some insurances, but most of that is covered. So do your preventative things, control your diet, exercise, eat right, and again, understand what your risk factors are in your family history, because there may be some things that you're predisposed to that you're not really monitoring or trying to modify today. And so you want to understand that stuff and make sure you bring that up with your healthcare provider, with your PCP, so that they can also be looking for those things.
Well, awesome. So we've had a fantastic conversation today, and I just want you to take a quick 20 or 30 seconds, and just offer some encouragement to those people out there, to the young boy, to the young girl that's watching this show today. Just give them a little bit of encouragement real quick as we come to a close.
Okay, so I really would say focus on your education. Education is important. Don't cut corners. Do all the studying that you need right now that's going to help you in this world. You don't always have to go to college. I'm not going to be the person that say go to college, but there's also opportunities for you to learn a trade, to get a great career going. And then if you want to look into entrepreneurship, take those risks. Find a good idea, something that you're passionate about, and do it. Don't settle. Definitely take those risks.
Well, awesome. So we want to thank Terrance Adams for coming on the show today and speaking about all the various topics that he has today. So don't forget, guys, to follow Paducah NAACP on Facebook at Paducah NAACP. We appreciate you for watching our show. Stay tuned for more episodes. Thank you, guys, and we'll see you on the next show.